Hey guys. Well, it's almost Turkey Day for at least those of us in the US. It is Tuesday, November 21st, 5:36 p.m. I don't know why I keep wanting to give you guys like the exact time. Um, but apparently I do. Also, I did change my hair. So the gray was just reminding me too much of my mom. Um, and especially around the holidays and the fact that I haven't seen my biological family for decades now. It was time for a change. It's semi permanent, so it'll fade. It'll be easier to take out, and it was less damaging than doing a permanent, which might have had ammonia in it and stuff like that. So just finished straightening it right before I decided to record this. But I was having a discussion in the comment section of someone else's video the other day. My 2 cents specifically. So, and we were discussing foodie beauties, diabetes, and how when I myself was diagnosed as pre-diabetic, that was part of what made me change my mind about the whole weight loss thing and actually start my inroads to that journey. And somebody reached out after my comments, which are always long and windy, that they wished that their sister could hear what I had to say because they were concerned about her health. And to them, she consumes a lot of sugar. And, when they try to talk to her about it, I think the word specifically was used was the person was accused of being a bully or attacking. It was something along those lines. And so I said, well, I'll try to put out my own video discussing it, because it's important to, if you're pre-diabetic, to change before you actually become diabetic, because I think it's type 1 is the one the adults can get later in life, and type 2 is the one that children can just get regardless of their health or fitness, and that's lifelong. It might be reversed. I just know that the things that can happen once you're diabetic is scary, especially things like coma and death. So, I actually have queued up some articles to talk about the symptoms and such about the things. But hold on a second, I need a drink. This bottle is from a brand called Dr. Hydro, by the way, off of Amazon. In there I have just 5 Propel packets of raspberry lemonade right now. There's 0 sugar, so there's no calories per packet. It's just enough to flavor the water, because I seem to have a sensitive palate, and water, for the most part, doesn't taste good to me. So this lets me drink one of those a day. It's a gallon size. And It lets me drink one of those a day. So I'm keeping better hydrated than I used to. And it's not sodas or anything like that. And it's still technically water. It's just enhanced. Enhanced. So, yeah. When I was, I'll talk about my own, journey here a little bit first. So I was between 452 and 457 pounds when my doctor did my blood work, and he said, Dessa, your A1C is too high, you're pre-diabetic. And I think of all the things that you hear about, and there have been some commercials that have talked about it, at least in the past that I recalled, where you can lose your fingers or your toes, or I think whole feet. I was looking it up more recently for my fella, and the fact that his legs kind of stopped working actually might have been due to the fact that he's diabetic. So that's another thing. I mean, you could slip into a diabetic coma and die. And once you cross that threshold from pre-diabetic to diabetic, it seems like it's really hard to cross back. Possibly also impossible. We're going to cover that here shortly. It'll be a learning experience for both of us. Sorry. There's just some crap in my throat. The air's drier in the apartment because the heat's been on. So I do apologize for any potential throat clearing I have to do. So I did some research about dieting. I covered this before, but for those who have not watched my very long videos in the past, I did my research, and I found out that our bodies naturally, after 12 hours of not eating, they begin to eat, or they begin to use, I guess is the better word, the stores of fat that we have inside ourselves as energy, as opposed to whatever calories we would be taking in, or having whatever we take in be stored as fat. So, what I decided to do was calorie count, and then do 2 meals a day, at least 12 hours apart. Because I can't seem to stick to a very rigid schedule, as much as I know it would probably do me better. That's unfortunately not something I can seem to do. Oh, excuse me. It's not even that late. I mean, it's not even 6 o'clock. So, yeah. And my ADHD just decided to kick in with that yawn. I'll find that train. Just give me 1 second. Right, so it's essentially a take on intermittent fasting, but I know a lot of people, they do the windows where they can eat as opposed to the way I'm doing it. So I still call it intermittent fasting because there is periods of fasting that I do. So it still fits in that definition. I just kind of do Uno reverse, I guess, on it. So, I mean, it was kind of slow because I didn't always stick to it, especially around the holidays, sometimes my depression. I'd say fuck it, get some Chinese food. I mean, I still occasionally do that. But I mean, over the 5 years, I've lost over 100 pounds. I know, at least my last weigh-in, which was my last appointment with Matthew that I saw him in person, I was down to 335.1. So that's over 100 pounds. And that was mostly on my own. I've only been seeing Matthew a few weeks. I have not been able to see the cardiometabolic people yet because there's a waiting list. I was told it was going to be months before they even contacted me. So, yeah, most of it's been on my own. Just being more mindful of the calories and the spaces of time between when I ate. It helped me a lot. I do things like I keep light popcorn around. It's 100 calories for a bag of popped. And then I have from Walmart their butter flavored spray. And I use that to kind of spritz some of the popcorn after I've added like half the bag to the bowl. I'll spritz it, just short little bursts. And then I take some popcorn seasoning. I have right now nacho, white cheddar, or kettle corn. In case I want sweet as opposed to salty. And I'll sprinkle it just little bit. And then I kind of toss. But the butter spray helps it adhere and it doesn't add calories. And that way I'm not just shaking a bunch onto it either, because I don't need to, because it's adhering because of the spray. And then, I put the rest of the popcorn on, shake, toss, and there we go. I mean, everything's pretty covered, but it's not redundantly so. Like, it's not like just a whole bunch of salt in your mouth either. So it keeps the calories very low, and it's a relatively filling snack. It's actually approved by my health coach because I told him that I do it. Because sometimes in between the meals I do get too hungry, and sometimes my stomach will growl and I can ignore that. But if the headache starts, I can't ignore that. Sorry, right by my nostrils itching. So yeah, I'll do that. I've just recently bought some ambrosia apples, which are the most amazing apples, I think, because they're like a pear and an apple had a baby. They're definitely more on the firm side, but they're still sweet. They're not tart. They're great to eat. And they're not heavy in calories. And I don't peel them. Because according to Matthew, my health coach, most of the fiber is in the peel. Now, when you look at applesauce, you would think, well, that's where the fiber is. Apparently not. It's in the peel. That itty bitty thin peel is the majority of the fiber content when you see like nutrition labels for apples. So my recommendation in the future for those who are using apples as something to get their fiber and, they're using as part of a diet, eat it with the skin. If you can portion out peanut butter, that's a great way to get some additional protein and a healthier fat. I like doing that. Especially for like a breakfast sort of thing or a later night snack. But, so I do occasionally snack. I also keep some Trident gum around. There's a melon one that I have and a whitening one. Because I like to chew the whitening one like right after I eat. It helps get any potential things that are like kind of stuck in my teeth. And and also freshens the breath, especially since I like to eat things like that have garlic, onions. I like veggies, but sometimes veggies make a breath stink. So, um, so yeah, I mean, those are some of the tricks I use to get around having sweet things. Zero sugar drinks. Specifically those with sucralose. Like, I tried stevia. Not a fan of stevia, which is a shame because Real Lemon or True Lemon, they make their own drinks, like their little packets too, and I wanted to like them because they're made with real lemon and other fruit, and then the stevia. That aftertaste is so bad. And I had Tom try it too because when I got it, he was still here, and no, neither one of us could actually I couldn't finish. Like, I made a gallon of it, couldn't finish it. I had to dump it out. I felt bad. I don't like wasting food, and to me that's still considered food. But again, me and Matthew discussed this, but the sucralose, you have to drink obscene amounts before you're getting into like the carcinogenic levels. So he didn't think that there was a problem with the way I was doing my intake of the additive sweetener. I don't know if my energy drinks use sucralose, but the energy drinks I get, I limit myself to one a day because I limit my caffeine. Just to be on the safe side with things, especially with me being on something for my ADHD and stuff like that. And if I do need an additional pick-me-up, I have caffeine pills that I keep around primarily for when I get migraines because of light sensitivity. But sorry. There's a noise going on in that direction. Above and to the left. So I think in the apartment above me. And it's a little distracting. So yes, zero sugar energy drinks, my packets to add to my water, even like Mountain Dew, Pepsi. I mean, they taste better than diet drinks, and they taste closer to the regular sugar ones. So they're actually a really great switch where you don't feel like you're really missing out on much. So, I mean, if you're trying to make healthier changes to how you eat in the ways of reducing your sugars, maybe some of the things I've mentioned are things you can look at. Because I look at it a lot. Actually, during my last phone call with Matthew, he said he was actually kind of impressed with how I've been paying attention to labels and my macros, the macronutrients like fibers and stuff like that. Because I've been trying to balance things better because, as he's explained to me in the past, making sure that the protein you take and the fiber you take will keep your blood sugar more even. No, I wasn't talking to you, Grandpa. My assistant chimed. So, if you can keep your blood sugar even, the less hunger pains you're going to get. So the less likely you are to snack and stuff between your meals. So that's, what I'm trying to do. I mean, if people want more specific swaps that I've done, like light mayo as opposed to regular mayo, for those with a Walmart around, the Great Value mayo, the light, tastes pretty much just the same as the regular. And the calories are vastly different. I think per serving, regular mayo is 100 and light mayo is 30. So that's a 70 calorie difference per, I think, 2 tablespoons. So it's significant. Especially if you make tuna or something like I do, it adds up. Because I'll make, it certain batches ahead of time. Light dressing, Italian, ranch, actually not so bad as light versions. They're really not. I was surprised. I don't know if the vinaigrettes would translate well, like balsamic, if it's a light, because I know they have to replace. There's usually some sort of sugar in there, like a raspberry sort of vinaigrette or something. So I don't know, but I'm not really a vinaigrette girl. I guess Italian dressing is almost like one, but it just feels different enough to me. Because I know there's vinegar and oil in it, but then there's all those seasonings. Let's see. Trying to think of... as far as bread goes, I got myself turkey burgers recently, and to serve them up as sandwiches, I got myself everything bagel thins. They're only 110 calories for the top and the bottom. I mean, they're thin. They're very thin. But they have both a decent amount of protein and fiber to them. More so than the multigrain thins I was looking at, and certainly less calories than multigrain bread, which is usually about 110 calories for a slice. Yeah. I mean, the everything flavor is mild, but I mean, if you I put them in my air fryer toaster or air fryer oven, and so they get a little bit more on the crisp side, and that actually works out really well for me. Because then when I put mayo or something on it, it doesn't get too squishy or whatever. And I mean, it lends a flavor enough. So, I mean, I recommend. But I mean, you can look at things on the labels and stuff like that, and you can make your own choices. But I mean, I think dieting the way, or following the weight loss journey, or however you want to word it, the way I am, I don't think it's that difficult. Because I'm not really overly restricting myself. I'll still have rice. I'll still have pasta. I just talked about still having, thin bagels, but bagels. I have English muffins for when I make my tuna. But you balance it. Make sure you're having some nice, fibrous veggies. You got your proteins. Make sure you're having more proteins than anything else. And, be mindful of how much you're eating. And taking off the weight will help you avoid the issues that you could have by getting diabetes. So, we're going to talk about prediabetes first because that is, in fact, what comes first. And I'm taking this specifically from Mayo Clinic, by the way. And prediabetes means you have a higher than normal blood sugar level. It's not yet high enough to be considered type 2 diabetes yet. But without lifestyle changes, adults and children with prediabetes are at high risk to develop type 2 diabetes. So I had it backwards in the beginning. So reverse what I said there. If you have prediabetes, the long-term damage of diabetes, especially to your heart, blood vessels, and kidneys, may already be starting. There's good news, however. Progression from prediabetes to type 2 diabetes isn't inevitable. Eating healthy foods, making physical activity a part of your daily routine, and staying at a healthy weight can bring your blood sugar levels back to normal. The same lifestyle changes that can help prevent type 2 diabetes in adults might also bring children's blood sugar levels back to normal. Prediabetes doesn't usually have any signs or symptoms. One possible sign of prediabetes is darkened skin on certain parts of the body. You know how people are commenting about Amber Reed's knuckles and stuff? That might be it. She might want her blood sugar checked. Affected areas can include the neck, armpits, and groin. Well, that last one, if you have someone you can trust, they'll go looking for you. Classic signs and symptoms that suggest you've moved from prediabetes to type 2 diabetes include increased thirst, frequent urination, but I do that because I drink a gallon of water a day. So, increased hunger, fatigue, blurred vision, numbness or tingling in the hands or feet, frequent infections, slow healing sores, and unintended weight loss. I don't know how that last one works, but I wish they explained it. Next, they go into causes. The exact cause of prediabetes is unknown, but family history and genetics appear to play an important role. What is clear is that people with prediabetes don't process sugar glucose properly anymore. Most of the glucose in your body comes from the food you eat. When food is digested, sugar enters your bloodstream. Insulin allows sugar to enter your cells and lowers the amount of sugar in your blood. Insulin is produced by a gland located behind your stomach called the pancreas. Your pancreas sends insulin to your blood when you eat. When your blood sugar starts to drop, that means you're going to be getting hungry. The pancreas slows down the secretion of insulin into the blood. When you have prediabetes, the process doesn't work as well. As a result, instead of fueling your cells, sugar builds up in the bloodstream. This can happen because the pancreas may not be making enough insulin, or your cells become resistant to insulin and doesn't allow as much sugar in. The same factors that increase the odds of getting type 2 diabetes also increases the risk of prediabetes. These factors include weight. Being overweight is a primary risk factor for prediabetes. When the more fatty tissue you have, especially inside between the muscles and skin around your abdomen, the more resistant your cells become to the insulin. Waist size. A large waist size can indicate insulin resistance. The risk of insulin resistance goes up for men with waists larger than 40 inches and for women with waists larger than 35 inches. So technically, I should consider myself still in the danger zone, but my blood work from this past year, like I said, he told me that my A1C was in the normal. So I'm now officially out of prediabetes. I still intend on continuing to lose weight, obviously. So it's just going to get better from here. And hopefully my gut will continue to shrink and therefore become less of an issue there. Diet. Excuse me. Eating red meat and processed meat and drinking sugar-sweetened beverages is associated with a higher risk of prediabetes. Okay, I'm going to pause here for a second because Matthew and I discussed red meat. He's actually pro-red meat. He says the reason why red meat is so demonized is because there's usually other things surrounding a diet that is high in red meat, like smoking, drinking, eating fried foods, because most people tend to get their red meat how? Burgers, fast food, there you go. And that's also, we do our sodas, so there you are. So red meat in and of itself, not a bad thing. Of course, you should limit how much fat is attached to that meat that you're eating. By removing the fat before you cook it or rendering it. Those sorts of things. But it's not as bad as some people say that it is. I mean, this is his job, so I'm going to take his word. And I've also read that, this is the truth of it. So, I'm going to listen to him. I mean, I can't necessarily afford to eat a whole ton of red meat anyway. But he thinks eggs are actually the best as a way of getting protein because it's simple. And for how small they are, they're kind of protein packed. And they have a lot of other good things about them. So he's definitely very pro-egg, above pro-red meat. But he eats red meat himself, he said. So, we had a conversation about it. And I just talked about the sugar-sweetened beverages before. I mean, as opposed to just a couple decades ago, we have so many options now as far as reduced calorie or 0 calorie drinks that just try, and when you find a sugar substitute that that tastes the best to you, then try to find other drinks that have that same thing. Again, don't go overboard, but I mean, I think like Crystal Light still does aspartame primarily. So if you're good with Crystal Light, then aspartame's cool, and then you can look at other things with aspartame and go from there. But that's also now considered so everything in moderation but crack. No crack. Everything else, moderation. Inactivity. The less active you are, the greater your risk of prediabetes. I need to get active again. I've actually stopped doing the walking, and maybe I shouldn't have. Oh, excuse me. But even if I just watched some sitting down exercise videos from like YouTube or something, Matthew said it still counts as long as it's engaging in cardio. He gave me a channel to look at, so I still have to look at it. If people show interest, I will share it with you. Let me know. Age. Although diabetes can develop at any age, the risk of prediabetes increases after age 35. Yeah, that was about the time I was kind of being warned about it. I mean, I was a little bit older than that. But yeah, that's it fits. If family history. Your risk of prediabetes increases if you have a parent or sibling with type 2 diabetes. So, talk to your folks. Find out, if there's, people in your family that diabetic. I'd say even go so far back as to check on, grandma or something. Because who knows? I'm being very fidgety today, and I'm sorry. I took my medicine, I swear. And now there's something in my eye. I'm so sorry. Race or ethnicity. Although it's unclear why, certain people, including Black, Hispanic, or American Indian and Asian, or Asian American people, are more likely to develop prediabetes. I didn't know that. I know there's something that African Americans are more inclined on getting, and I wish I could remember it right now at the top of my head. It's a blood disorder, I think. Oh, it's gonna bother me. Give me a second, guys. I am so sorry. Sickle cell disease, that's what I was thinking of. I knew it was something. But yeah, I didn't know that, wow. So, gestational diabetes. If you had diabetes while pregnant, you and your child are at higher risk of developing prediabetes. So, if you or your mom, depending on your gender, of course, if you had a kid or when your mom had you, if she was diabetic or you were, apparently you both have a chance. So, I'd check with your doctors just to be on the safe side. Sleep. People with obstructive sleep apnea A condition that disrupts sleep repeatedly have an increased risk of insulin resistance. People who are overweight or obese have a higher risk of developing obstructive sleep apnea. Thankfully, I don't seem to have this problem. Like, I don't sleep long, and I am a light sleeper, but that's damage. That's not health. um, but where I do snore, I don't have like hitches in my breathing. I don't stop breathing while I'm sleeping. I just occasionally snore depending on what position I'm laying in. Apparently, if I'm laying on my right side, and I usually sleep like this. My snoring is very quiet. If I'm on my left side and I actually have my hand like tucked under my pillow, so it's more like this, that's apparently where I start sounding a bit more like a chainsaw. Um, but it's not actual sleep apnea, it's just snoring. Polycystic ovary syndrome. Women with this common condition, characterized by irregular menstrual periods, excess hair growth, and obesity, have a higher risk of prediabetes. So, is this the PCOS, I think they call it for short? I don't have it personally, so if you do, you might want to look into it. Again, just to be better safe than sorry, because I think when we go into it, hopefully in the diabetes, like this shit can wreck your life, end your life. So, I mean, you got to be careful. The last thing is tobacco smoke. Smoking may increase insulin resistance and can increase the risk of type 2 diabetes in people with prediabetes. Smoking can also increase your risk of complications from diabetes. So if you actually go into actual diabetes and you're smoking, you can basically make things worse. Yeah, so especially if you're already wrecking your health with your weight, you shouldn't be smoking. You shouldn't be smoking anyway. I know people like to, and some people are going to be like, well, don't tell me what to do, but I mean, I lost my grandmother to lung cancer. I mean, she decided to go out like a boss, and she fucking smoked cigars until she couldn't, and everything else, and I wish she had just listened to her doctors, honestly. I mean, yeah, it was her terms and blah, 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 but I would rather have had her around. I think there was probably plenty of my cousins and whatnot and their kids that would have agreed. So, in the end, if you smoke, I mean, just consider maybe not anymore. And vaping counts. You don't want one of those things exploding in your face. Dude, no. And you never know. I wouldn't risk it personally. I wouldn't. But, I mean, other people are going to do what they're going to do. But I care, so I'm saying maybe don't. Other conditions associated with increased risk of prediabetes includes high blood pressure, low levels of high-density lipoproteins, also known as HDL, or HDL cholesterol, the good cholesterol, and high levels of triglycerides, the type of fat that is in your blood. So if you have fatty blood, apparently that can increase your risk for prediabetes and therefore diabetes. When certain or metabolic syndrome, when certain conditions occur with obesity, they are associated with insulin resistance and can increase your risk for diabetes and heart disease and stroke. A combination of 3 or more of these conditions is often called metabolic syndrome. High blood pressure, low levels of HDL cholesterol, aka the good cholesterol that was just mentioned before, high triglycerides, the fatty blood, which was also mentioned before, high blood sugar levels, and large waist size. Everything that was covered before, essentially. So, if you're currently having some of these things going on, plus if you smoke and your eating's kind of unchecked, you might want to reevaluate. Complications. Prediabetes has been linked with long-term damage, including to your heart, blood vessels, and kidneys, even if you haven't progressed to type 2 diabetes. Prediabetes is also linked to unrecognized, in parentheses, silent, heart attacks. Prediabetes can also progress to type 2 diabetes, which can lead to high blood pressure, high cholesterol, heart disease, stroke, kidney disease, nerve damage, fatty liver disease, eye damage, including loss of vision, and amputations. Prevention. Healthy lifestyle choices can help you prevent prediabetes and its progression to type 2 diabetes, even if diabetes runs in your family. These methods of prevention include eating healthy foods, getting active, losing excess weight, controlling your blood pressure and cholesterol, and not smoking. So, that's everything they have. Mayo Clinic, by the way. So, it's pretty reputable. That's why I usually go to them first and foremost when I want to look up something like a particular med or something, Let's switch back over to diabetes. Overview. Diabetes mellitus, mellitus, refers to a group of diseases that affects how the body uses blood sugar, glucose. Glucose is an important source of energy for the cells that make up the muscles and tissues of your body. It's also the brain's main source of fuel. I was just thinking about the seminar that I recently went to and about how when we're overweight, the food that we're eating, it's not only fueling our fat cells and our body in general, but it also fuels irregular cells. And those irregular cells, of course, have the chance of becoming cancerous cells. And that's why they were doing the seminar, to try to help people to maybe think about considering weight loss, because it's an effective cancer preventative. So reading about the brain, it made me think of Tom and the fact that he's currently going through his battle right now, and part of me is pretty convinced that his glioblastoma is because he wouldn't lose weight. I mean, it's been a little over 2 years, so about 3 years prior, I've been doing my own weight loss thing. I was trying to show him that it's possible to do it, and he didn't want to. I kept, yeah, you just count your calories, split what you eat into 2 separate meals, but you can still eat what you want. I mean, you want pepperoni and cheese, have pepperoni and cheese, but just watch how much you're eating, and, you'll be able to lose weight. And makes me a little upset that in the end, maybe I'm losing him because he wouldn't save himself. Sorry, I got a little morbid there for a moment, but there's a reason why I do these videos. It's not just for me. Again, when this person was telling me about how they wanted to reach out to their sister about this stuff, and I hope that person's sister watches this and understand that you're being cared about. You're not being teased. You're not being bullied. Somebody cares and they don't want you to die. They want better for you. And it might seem hard at the start, but it doesn't stay that way. You just have to stick it out. You find the ways that it works for you, and you make it work. If you can have access to a dietitian, see a dietitian. They might have other tips and tricks that maybe I don't know, or, because they can talk to you specifically, they can work something that just works better for you. It's basically a slow way of ending yourself if you allow this to continue for yourself. So, on behalf of potentially whoever's showing this to you, or if you decide to click on this because you just maybe saw the title, it's going to have something with diabetes in it, so, and for whatever reason, somebody cares, and you should care about yourself enough to make those better changes. You should at least care about yourself enough to make those changes. Love yourself enough to make these changes. Because once you're gone, that's it. And after a point, apparently, you won't be able to fix it. So that's a whole nother thing. So, please, if you think this applies to you, help yourself. And you can even reach out to me, and I'll help you with a Google search, something, just please. The main cause of diabetes varies by type, but no matter what type of diabetes you have, it can lead to excess sugar in the blood. Too much sugar in the blood can lead to serious health problems. Chronic diabetes conditions include type 1 diabetes and type 2 diabetes. Potentially reversible diabetes conditions include prediabetes and gestational diabetes. Prediabetes happens when blood sugar levels are higher than normal, but the blood sugar levels aren't high enough to be called diabetes. And prediabetes can lead to diabetes unless steps are taken to prevent it. Gestational diabetes happens during pregnancy, but it may go away after the baby is born. Symptoms. Diabetes symptoms depend on how high your blood sugar is. Some people, especially if they have prediabetes, gestational diabetes, or type 2 diabetes, may not have symptoms. In type 1 diabetes, symptoms tend to come on quickly and be more severe. Some of the symptoms of type 1 diabetes and type 2 diabetes are feeling more thirsty than usual, urinating often, losing weight without trying, presence of ketones in the urine. Ketones are a byproduct of the breakdown of muscles and fat that happens when there's not enough available insulin. So basically, your body's breaking down because it can't fuel itself correctly. Feeling tired and weak, feeling irritable or having other mood changes, having blurry vision, having slow healing sores, getting a lot of infections such as gum, skin, and vaginal infections. Thankfully, I only ever had one UTI once at age 34 because I take care of my hygiene. Causes. To understand diabetes, it's important to understand how the body normally uses glucose, how insulin works. Insulin is a hormone that comes from a gland behind and below the stomach known as the pancreas. The pancreas releases insulin into the bloodstream. The insulin circulates, letting sugar enter the cells. Insulin lowers the amount of sugar in the bloodstream. As the blood sugar level drops, so does the secretion of insulin from the pancreas. So, basically insulin helps your body to understand that it's full. But of course, if you develop resistance, your body's not getting those signals from the insulin, therefore you're going to feel hungrier. Because your blood sugar's going up and down. You got to try to keep it as even as possible. The role of glucose. Glucose, a sugar, is a source of energy for the cells that make up muscles and other tissues. Glucose comes from two major sources, food and the liver. Sugar is absorbed into the bloodstream where it enters cells with the help of insulin. The liver stores and makes glucose. When glucose levels are low, such as when you haven't eaten in a while, the liver breaks down stored glycogen into glucose. This keeps your glucose level within a typical range. The exact cause of most types of diabetes is unknown. In all cases, sugar builds up in the bloodstream. This is because the pancreas doesn't produce enough insulin. Both type 1 and type 2 diabetes may be caused by a combination of genetic or environmental factors. It is unclear what those factors may be. Risk factors. Risk factors for diabetes depends on the type of diabetes. Family history may play a part in all types. Environmental factors and geography can add to the risk of type 1 diabetes. Sometimes family members of people with type 1 diabetes are tested for the presence of diabetes immune system cells and autoantibodies. If you have those autoantibodies, you have an increased risk of developing type 1 diabetes. but not everyone who has these autoantibodies develops diabetes. Rare or erase or sorry, trying to read and talk at the same time has never been my strong suit, but I'm trying here, guys, because it's important to get this education. Race or ethnicity also may raise your risk of developing type 2 diabetes, although it's unclear why certain people, including Black, Hispanic, American Indian, and Asian American people, are at higher risk. Prediabetes, type 2 diabetes, and gestational diabetes are more common in people who are overweight or obese. Complications. Long-term complications of diabetes develop gradually. The longer you have diabetes and the less controlled your blood sugar, the higher the risk of complications. Eventually, diabetes complications may be disabling or even life-threatening. In fact, prediabetes can lead to type 2 diabetes. And I was discussing some of these before. So for those who maybe haven't been paying attention to some of the stuff I've been reading, please pay attention to this part, because this is going to tell you the things that can and more likely will happen to you if you let yourself become diabetic. And if you are, you don't take the proper steps to keep it in check. Heart and blood vessel disease, known as cardiovascular diseases. Hold on. Something on my screen. Diabetes majorly increases the risk of many heart problems. These can include coronary artery disease with chest pain, angina, heart attack, stroke and narrowing of the arteries, atherosclerosis. Yeah, I'm going to go with that. If you have diabetes, you're more likely to have heart disease or have a stroke. Nerve damage from diabetes, diabetic neuropathy. Too much sugar can injure the walls of the tiny blood vessels, capillaries, that nourish the nerves, especially in the legs. This can cause tingling, numbness, burning, or pain that usually begins at the tips of the toes or fingers and gradually spread upwards. For the record, this is actually also the start for Guillain-Barré/CIDP. So, for whatever the reason, if your toes, your fingers, they start going numb, your feet, your hands, they start following suit too, get the ass to a doctor, okay? It's important. Do it. Because, I mean, you could lose limbs, you could have your whole body shut down. Mine nearly did. So, don't fuck around. Please. Damage to the nerves related to digestion can cause problems with nausea, vomiting, diarrhea, or constipation. For men, it may lead to erectile dysfunction. So, fellas, diabetes will possibly cause your dick to stop working. If you want it to keep working, don't get diabetes. Or keep it in check if you already have it. Lose the weight. Save your pee-pee. Okay? Okay? Kidney damage from diabetes. Diabetic nephropathy. The kidneys hold millions of tiny blood vessel clusters. Glomeruli. That's what we're going to go with. That can filter waste from the blood. Diabetes can damage this delicate filtering system. You kind of need your kidney. I'm pretty sure you need it. I know your gallbladder you can do without. I don't have mine anymore, so I know for a fact. Do the kidneys come in pairs? So you can Donate one. I really got to get better at anatomy. I'm slowly learning though. I am. Eye damage from diabetes. Diabetic retinopathy. Diabetes can damage the blood vessels of the eye. This could lead to blindness. Imagine you never being able to see a thing again. Do you really want that to happen? This can be prevented. Take better care of yourself. I've had these since I was 12, so that's not a diabetes thing. That's just me being nearsighted. Foot damage. Nerve damage in the feet or poor blood flow to the feet increases the risk of many foot complications. I don't know why they're not saying including having your foot fucking removed. You don't want that. I mean, that's really gonna put a damper on being able to dance. Just, a lot of things. It's just going to put a damper on a lot of things. And no, people aren't going to sell you shoes half off just because you want one of them. So, I don't know why I'm making these stupid jokes sometimes, but that's just what I do. So yeah, you can lose toes, you can lose the whole foot. I don't know if you can lose more than that, but I wouldn't want to risk it. Especially if you're a heavy person. I mean, imagine how hard it is already getting around. And then imagine having to do it with just one foot. And then you have to deal with like a crutch. Or you have to deal with a prosthetic, which comes with its own complications. The fact that you have to keep, fiddling with it, taking it on, or putting it on, taking it off. When you go to take a shower, you can't, I don't think you can wear them in the shower. If you don't want that to happen, make changes. Skin and mouth conditions. Diabetes may leave you more prone to skin problems, including bacterial and fungal infections. Did not know this. So, yeah, apparently it'll mess with your skin, but I'm sorry. So far as I understand, the teeth I can kind of understand. Like if you're eating a lot of sugary things and whatnot, it's gonna fuck with your mouth anyway, but really slow healing wounds. If you have acne and of course you pick at it, and then they get infected. I guess I can kind of see it, but I wouldn't have imagined it. Hearing impairment. Hearing problems are more common in people with diabetes. So not only can you become blind, but you can become deaf. Yeah, I am so glad that I made the changes I did. I had no idea. I could be potentially going through my existence not being able to hear correctly or see. That's scary. That's honestly scary. Not as scary to this. Alzheimer's disease. Type 2 diabetes may increase the risk of dementia, such as Alzheimer's disease. So you can also essentially be losing everything. Your memories, your ability to perceive what's happening around you. When we had the commitment ceremony or celebration of life ceremony, I guess is what they were calling it, for Listen James, Tom's great grandmother was there. Or regular grandmother, not great grandma. Tom's grandmother was there. And she has dementia pretty bad. And she was like barely there. Like, watching her eat was weird because she was just so very absent-minded about it. And her stare was just, she wasn't present. And there was just all these people around her trying to talk to her, trying to interact with. Nothing. And I mean, I've known her for a while, and it's actually kind of depressing. And I think that's why I've made a better commitment to myself about trying to keep my mental health as sharp as it is, like my faculties and whatnot. Because it's one of the strongest tools that I have, and I can't imagine just existing like that, because that's basically all she's doing at this point. It is just existing, and fuck, that's shitty. She really was such a great person. When I was going through my CIDP, she came to the hospital to see me. She brought her hairdresser in to wash my hair and cut it and stuff because, I couldn't do those things myself. Tom's family, for the most part, has been really damn good to me. So to see his grandmother like this, it's hard. I'm sorry, just give me 1 sec. Oh, fuck, I'm sorry. We're almost done. I know I'm going long with this, but it's important. And I hope you've been sticking with me, and I appreciate it if you have. And I hope this is helpful. Not me being a fucking blubber, but depression related to diabetes. Depression symptoms are common in people with type 1 and type 2 diabetes. I mean, your health is shit. I mean, especially if you are trying to do the whole diet thing. You're probably unhappy that you have to do that. And so, if you can avoid it. Fuck, why am I yawning so much? I'm sorry. Maybe because it's the light. My eyes just don't want to be in the light right now. But eyeballs, we're almost done. promise. Complications of gestational diabetes. Most women who have gestational diabetes deliver healthy babies. However, untreated or uncontrolled blood sugar levels can cause problems for you and your baby. Complications in your baby can be caused by gestational diabetes, including excess growth. Extra glucose can cross the placenta. Extra glucose triggers the baby's pancreas to make extra insulin. This can cause your baby to grow too large. It can lead to a difficult birth and sometimes the need for a C-section. So, especially those who want to do the natural birth route and whatever, and I highly suggest if you can do, because, thankfully I knew I was basically doing one and done because I wasn't intending on getting pregnant to begin with, but I went through a C-section because she started to struggle and we found out the umbilical cord was wrapped around her neck 3 times. But when you have a C-section done, first of all, there's a scar that's pretty much never going away, right? In your bikini area. But any future pregnancy that you have, your baby's probably going to have to be delivered the same way because there's just too many complications of trying to have a natural birth after having a C-section, including having the uterus burst at that point and stuff like that. Like it's a problem. So, if you can do just regular push them out, way out, do it that way. Low blood sugar. Sometimes babies of mothers with gestational diabetes develop low blood sugar, hypoglycemia, shortly after birth. This is because of their own insulin production being high, I guess, previously. Type 2 diabetes later in life. Babies of mothers who have gestational diabetes have a higher risk of developing obesity and type 2 diabetes later in life. Well, we didn't cover the higher risk of obesity because they didn't cover it, but they did mention in the prediabetes that gestational diabetes increases the risk of diabetes in both mother and child. Death. Untreated gestational diabetes can lead to a baby's death either before or shortly after birth. So, don't leave this untreated if you're wanting a baby and you're going through all this, take care of yourself and the baby. Complications in the mother also can be caused by gestational diabetes, including, I think this is called preeclampsia. Symptoms of this condition include high blood pressure, too much protein in the urine, and swelling in the legs and feet. And gestational diabetes. If you had gestational diabetes in one pregnancy, you're more likely to have it again with the next pregnancy. Prevention. Type 1 diabetes can't be prevented, but healthy lifestyle choices that help treat prediabetes, type 2 diabetes, and gestational diabetes can also help prevent them. Eat healthy foods. Choose foods lower in fat and calories and higher in fiber. Apparently green beans, high in fiber and actually have some protein. Recently found that out. So, I forget the content of the protein, but it was, I at least got a yes when I asked the assistant because I was curious because I recently discovered that broccoli per serving has 4.2 grams of protein. Broccoli does. So I was curious about that, and so I asked the assistant, if green beans had it, and I was given a yes, but then Also by the Heart Association, they're highly recommended as a food, as a vegetable, because they're also good in fiber, which is good for the heart. So wanted to share that tidbit for that reason. Get more physical activity. Try to get about 30 minutes of moderate aerobic activity on most days of the week. My health coach says different. He says that he takes the approach of the minimum effective dose. So he was just having me walk around for 10 minutes straight, doing it at a good enough pace where I could hold a conversation if I were to. Not so fast that I'm like becoming dizzy or some such, because I'm out of breath. So doing that every day if you can, or something else that is basically going to engage your cardio for about 10 minutes at a time, will be effective, especially if you are overweight, because there's more of us to move around, therefore it's effective. It is. Or aim to get at least 150 minutes of moderate aerobic activity a week. Again, I just, for example, take a brisk daily walk. If you can't fit in a long workout, break it up into small sessions throughout the day. Lose excess pounds. If you're overweight, losing even 7% of your body weight can lower the risk of diabetes. For example, if you weigh 200 pounds or 90.7 kilograms, losing 14 pounds, about 6.4 kilograms, can lower your risk of diabetes. But don't try to lose weight during pregnancy. Talk to your provider about how much weight is healthy for you to gain during pregnancy. To keep your weight in a healthy range, work on long-term changes to your eating and exercise habits. Remember the benefits of losing weight, such as a healthier heart, more energy, and higher self-esteem. So, that's it for this article. So, I'm going to stop those there. Especially since we're going into an hour and a half here. So, I at least learned some things. Hopefully other people have stuck around for the duration. So, you've learned some things too. And in the end, maybe some of you will have the same understanding that I did, and now even more do, that diabetes is something to take seriously. It's not like acne. It's so much more dangerous. So you gotta take it seriously. Again, most of all, you should be doing it for you first and foremost. But if not, think about the people that are close to you, that love you. Especially if someone was the one who sent this to you, said, hey, I'd really like it if you watched this and listened. And hopefully if someone did that, then I hope I hadn't made things too boring or uninteresting. I mean, that's the same thing as I hope I made it worth your time, because I don't want to waste people's time, but I feel like this is important. And I rumble. And we're getting a little bit of cat action. Making sure you don't get a bit of butt. Love yourself more. Especially, if your doctor has told you, hey, your A1C's high, you got to do something about it, or it's going to become a lifelong struggle. Because apparently I was wrong that Even the type 2 diabetes, once you have it, you apparently have it. So, get ahead of it before it becomes part of your life. And if it is, make changes so it's not going to affect it so drastically. I mean, I read to you the ways that it can hurt you, can end you. And no, YouTube doesn't like certain words, but I mean, love yourself enough. Love the people around you enough. Everyone in this world should matter. And they should be here. So, I hope in the end you watch this, you decide to continue being here, and you make some good choices for yourself. And maybe because I've posted like, I don't know, close to a dozen videos now, I'm going to finally start saying it. If you liked this video, can you please hit the thumbs up and, subscribe too? It'd be really appreciated. Just so I know that people are watching. Definitely leave a comment if you want me to discuss more about this or some other topic. I mean, I'm here, so I'm willing to discuss pretty much anything. So don't hesitate. I mean, that's what the comment section's for. And if I know there's something specific someone wants to have discussed, I'll be able to do some research ahead of time or try to write it out better so I'm not losing track and, do a better job of producing a video. And hell, if I can get enough people and enough people want a specific thing covered, maybe I'll do a live. I thought about doing that when I was straightening my hair, but that didn't seem like that was gonna be a thing. So in a little bit here, I'm gonna put some braids in it and then some hair beads, because I got me some of these. Don't know if you can see them, so there we go. So yeah. Now, obviously, I know I'm putting this out right before Thanksgiving, where there is a lot of food that's going to be had by most, at least if you're in the States. So just try to be mindful of how much you're eating. Remember, leftovers are a thing and can be a great thing. And just balance that food. And, eat slow so when you feel full, you stop. That's going to be my advice. But I hope those that can spend time with family have a great time with family. Nothing too anger-inducing. Those who can't, maybe do that Friendsgiving thing and, just be around the people that you care about. Be thankful for the things that you have in life. And just, for many, enjoy the long weekend. Yeah. And I will try to do more tomorrow because I don't even know if I'm doing anything on Thursday, but tomorrow's Wednesday and I don't have anything else planned. So, might as well do something, right? I'm an idiot. Anyway, good night, everybody. Talk to you later.